The most common form of heart disease in the UK is coronary artery disease, where you get fatty plaques building up in the heart arteries. These restrict the flow of blood to the heart muscle, and that can give rise to chest pain and breathlessness. And sometimes these fatty narrowings can rupture and clots form in the arteries, and that's what causes a heart attack. The coronary arteries is a big problem. It's the UK's biggest killer. 74,000 people a year die of the problem in the UK. That's nearly 200 people a day. And there's over 2 million people living with the disease. So it's a really important issue for the whole population. There are some risk factors for coronary artery disease. If you have a family history of it, if you have high blood pressure, diabetes, if you're a smoker, if you're overweight, these all increase the chances of having heart disease. There are also some racial groups like Asians who are more at risk of heart disease than others. We still don't know the actual cause of the disease, what actually is the fundamental problem that causes these plaques or narrowings to build up. But we do know what can increase the risk of it. And what we think is that the arterial wall is damaged by problems such as high blood pressure or the insult of smoking, and that allows fat to leach into the artery wall and cause these fatty plaques to build up. The higher your cholesterol, the more likely this process is to develop. So the main symptoms of heart disease are chest pain, chest tightness, breathlessness, and palpitations or blackouts. So dealing with each of those, the key thing about chest pain that's caused by heart disease is that it usually comes on when you exert yourself. So if anyone notices a pain, usually in the chest but sometimes in the jaw or the throat or the arm, that comes on every time they go for a walk or go upstairs, then that's an important symptom and they should see their doctor about that. If you have unexplained increase in breathlessness, the same thing applies. Palpitations are not usually a serious problem, but still they need looking into, and it's worth going to your GP if you're getting a sensation of the heart racing inappropriately. The risks are very well known, and it's very simple to dramatically decrease your chances of heart disease. I think the first thing to say is that if you have a bad family history, and what I mean by that is that if you've had family members having heart attacks or angina problems quite early on in life, before they're 60, then it's worth having your cholesterol checked and having a health check with your GP to make sure that you're doing everything you can to avoid the problem. If that's not the case, if there's no family history, then what you need to do is to first and foremost not smoke. Smoking very much increases the risk of heart disease, and it's the easiest and simplest thing to do to decrease your risk. You also need to keep an eye on your blood pressure and make sure that that's not elevated, and get that checked out by your GP. You also need to watch your diet, and the best sort of diet is a Mediterranean diet full of fruit and vegetables and fish and low in saturated fats. Plenty of exercise and avoiding getting overweight, because getting overweight increases the risk of diabetes, which is a key risk factor for heart disease. So we made a lot of progress in the treatment of heart disease. We have good medication to help control blood pressure and cholesterol. Heart attack treatment is dramatically better than it was 10 years ago, but still too many people have the problem and too many people die of it. And it is really important that the very simple messages about not smoking, exercising and eating the right food are listened to, and you want to listen to those and make changes in your life before something happens and you've left it too late.